Hello. Good morning, honorable members.
Morning, Chairperson.
Honorable MEC. Are we still struggling to get the honorable MEC? I didn't go through to the attendance register. Honorable MEC, is the honorable MEC here? Okay. Honorable Munama is here. Honorable Munama, Honorable Maretz, Honorable Sono, Ndate Mawasha, Ndate Kosa. I'm trying to scroll down. Mera Masilu, Mema Sove, Mema Wisele, Ndate Tuwahale. Yeah, we're still waiting for other honorable members. Lerato, could you advise when the honorable MEC is in and the HOD and the collective team of the department? Because I can see Honorable Marais is here. I'll get your advice, Lerato, when everybody's in the meeting. We're just 4 minutes behind schedule.
Let me call the HOD. The HOD. Well. Okay.
To Angawa department, could you kindly mute your mic while you are arranging yourselves? Dadera Rapepele. Good morning. I can see you are here from communication. We really appreciate your presence.
Thank you, Honorable Chair. Good morning to you too.
Morning. Yeah, I can see the department, they are putting together a team on a boardroom. We really appreciate that. Let's hope they will all be in within. Welcome, Honorable Mtileni, Honorable Maharaj, Honorable Manaka. They have not yet came in. Can you kindly check Honorable Mtileni, Honorable Munyamani, Honorable Maharaj, Honorable Lepia? They have not yet joined.
Okay, Chairperson.
Hello. I know, I'll put it.
Honorable VS in, thanks very much.
Chairperson.
Hello, Malivia.
Hello, Chair.
Thanks. Hello, Honorable Libya.
Kindly note Honorable Managa is still in the other meeting. We were in another meeting, myself and her. Whoever calls me in, can they also call her in inside this meeting? I think we had connected in that previous meeting we had.
Oh, yes. Oh, yes.
Yeah.
Okay. All right. Thank you. Could we request IT, our IT to man makuba kumela phone na man manaka banga bangena ka mithini yo sungula wa hina wa prep abase huma ndeni ka loya. It's a wrong meeting. And Mami Yaman also, and Honorable Mutileni, can we just call them so that they log out and join the correct meeting? to our department, could I check with the Chief of Staff? Do we have got the Honorable MEC in the meeting? I can see the team is on a round table. Can we just double check? Can you talk?
They are asking for the Chief of Staff, not the HOD.
No, it's fine. I can see my MEC has just joined. She has just joined through a gadget. Thank you very much, Chief of Staff. Can we get the HOD? Or do we have got somebody on behalf of the HOD? Because I can't see the HOD. Is the HOD in our meeting? Oh, there she is. There she is. Oh, I can see now. Is she the one with goggles? There with a black a black top and a mask, a black mask. Is that my HOD? Can it be confirmed?
Good morning, Chairperson. Yes, it is, Chair.
Oh, thank you very much, HOD. Thanks very much. And team health, are we all here? I can see my MEC is driving. Honorable MEC, thanks for joining.
I've got the whole team with me, except for one DDG Corporate Services who is not well today.
Okay. Honorable MEC, unmute yourself. Unmute, Honorable MEC. Kindly unmute. You are still muted. Okay. Chief of Staff, can you call the MEC so that she can mute herself? Because we are struggling to hear. We can't hear. We can see you, MEC. You are trying to speak, but we can't hear you. You are still muted. No, she's still muted.
Honorable, she's saying when she's trying to unmute, she can't unmute.
Okay.
Yes.
Let's give her time a little bit. It might be the gadget is giving a little bit of trouble.
They are listening, MEC?
Yeah, just indicate, I think I'm over the phone where I'll join the rest of the team. Because I'm struggling with this.
Honorable Chairperson?
Yes, I could hear. She's struggling to, she'll be joining the boardroom. But in terms of procedure, we'll wait for the MEC until she is able to open the meeting. Because if she could fully open the meeting and deal with the traditional items, and she can hand over to whoever she wants to delegate. But we can't start in absence. That's the problem. How far, Chief of Staff? Can we wait for her? For how long? Sorry, for how long?
Let me just check with her, but I think I heard the car parking. It might be 2 or 3 minutes, but let me check with her.
Thank you very much. Honorable members, with your indulgence, could we allow that the MEC should be able to get a seat? She was trying to connect to a car, and I can see she's struggling a bit to speak to us. And we can't start without the member of the Executive Council. Can we allow colleagues to update me? What's going on with Honorable Mamunyamani? Are you getting her? Larato?
Thanks, Chairperson. I'm still trying to call her on another number.
Okay, and Honorable Mutileni, Honorable Maharaj.
Honorable Maharaj is in another meeting.
Honorable Mutileni.
I also can't get hold of him. I'll keep on trying him.
Okay.
All right, thanks.
Thank you very much. I can see the Honorable MEC is she's now settled, and we really appreciate presence in the meeting. It's just that it's 14 minutes beyond schedule, and as a medical practitioner, she's aware that immediately you miss a second on a patient, it means you are inviting something that is not in the best interest of the department. But we understand. She briefed me that she's a little bit held up, but she will join us. And here she is. We want to appreciate your presence. Honorable members and members, are we correcting as members of the portfolio committee? How many honorable members are here? 1, 2, 3, 4, 5, 6, 7. 7. Yes, we are correcting. Mami Yaman has just joined us. Can we put the agenda? Can you fly the agenda? Can it cover the entire screen? Thank you very much. I think the agenda is straight to the point. Opening and welcome. Roll call and apologies. Responses from the MEC from the MEC of the Department of the Department of Health on outstanding matters. I think we had an outstanding issue in the previous meeting. If we can get a brief on that. 4, it will be a briefing by the Department of Health on the 2021-2022 annual performance report, performance plan and budget, discussions and questions. We'll declare the meeting officially open and welcome all honorable members, the honorable MEC and the entire entourage of the department led by the HOD, the administrative component of our legislature, led by Mema Sobe. We really appreciate the presence of our legal team, the section on communication, and also the section that is led by Mema Sobe and yourself, Mema Sobe, in the meeting. We really appreciate your presence. Without much ado, we'll also try to get ratification of the agenda after item 2. Opening, as I said, I declare the meeting officially open and welcome everybody who's in the meeting. As I've enlisted all honorable members, including our administrative staff, the ever-working staff of the department, and also the ever-working staff of our legislature. We really appreciate your presence. We'll go to item number 2, which is roll call and apologies. Could we be advised, Mema said, would we be advised in terms of the apologies?
Thank you, Chairperson. Good morning, honorable members and colleagues and all colleagues from the department. The only apology that I have is that Honorable Maharaj is in another meeting. Yeah, I think that's the only one so far. Thanks, Chairperson.
Thank you very much. From the department, any apology? I heard our HODs raising an apology from the department.
DG Corporate Services is
okay. Yeah, I think we only have one apology. I think the HOD has already rendered the apology of DDG Corporate Services. Otherwise, all of us are here.
Thank you very much, MEC, and for a speedy recovery, for the speedy recovery of the DDG. We really hope that she will join us in other meetings. We will go to item number 3, responses from the MEC for the Department of Health on the outstanding matter. Honorable MEC, you might be aware that we have postponed one meeting and we should have reconvened. Unfortunately, we were held up after the instruction by the Premier Honorable Premier, that we deal with the issue at Mbilu High School, an incident that shouldn't have happened, but we really appreciate that you were able to go there with an MEC of Education and try to bring the team of our Department of Health on psychological assistance and other related matters to our peoples there at Mbilu High School. But before that, we had an outstanding matter. We should have had a discussion. We just want to get a brief from the MEC in relation to how's the matter being handled and how far are you with the matter? Because as a committee, we believe we have given the department enough time to can deal with the matter. Honorable MEC.
Thank you, Chair. My apologies for the delay. One of the issue which had made me to delay was that unfortunately I was just busy with the MEC for Education again. I'm just raising it because you have just raised another issue. There's a learner, a grade 8 learner who just committed suicide at Kwaratlo Secondary School. So I think it's becoming a trend. You'll remember last week she also had another learner from Palabura who committed suicide. So I was just trying to get the team to assist them. We probably might have to request our clinical psychologist and our psychiatrist. Probably one might have to do a study on the trend about our teenagers. They are not able, in the past, I think when most of those who went to medical school at the same time with Dr. Mhlongo and myself, would have learned that girls usually don't commit suicide. They threatened to commit suicide. It's always an attempted or a parasuicide, but it's mostly on the male child. When they say the males, when they commit suicide, they really commit. But it has become a trend because when I do an analysis in Chilidzini postmortems that were done for the past 3 months, we have already had, I think it was 7. 3 of those were 13-year-old, and then there was a 14 and 15-year-old. So you can see that we are dealing with another pandemic of mental health amongst our teens. This one, the reason is that the parent said she must cook, and she refused to cook. So you see that it's not really a normal situation. So that is one of the issues that probably delayed one to try to attend to that emergency. But let me appreciate that the team has been able to be here on time and be delayed by me. Otherwise, on the matter that which is outstanding, Chair, I must indicate that the Department of Health is committed to working closely and building a strong relationship with the portfolio committee. Administrators led by our HOD, Dr. Mhlongo, they are also looking forward to be guided by the portfolio committee in order to deliver quality healthcare services for our people, because our mandate is the same. We all would want to find people of Limpopo receiving quality healthcare in our lifetime. And of course, honorable members, for me, you will know that I have just been delegated to oversee the Department of Health as an executive authority, but I'm still part of the member of the legislature. So there is no way that you can find the department undermining or not willing to work closely, especially coming from me, because I'm part of the legislature, by the way. I've been sworn in as member of the legislature prior the Premier requesting and inviting me to join him in his executive council to be able to steer this administration and assist towards realizing the dream of a long and healthy life for the people of Limpopo. I've heard the concerns that were raised by the legislature, and be rest assured, the matter has been attended to, and the matter is being dealt with administratively. And I think that's what I would say, that and members must just be comforted with the fact that all issues that they've raised have been attended and they've been addressed. Thank you, Chair.
Thank you very much, Honorable MEC. And we should also highlight to the team here that this sitting, or this portfolio committee sitting, is live on YouTube. We should be alive to that. We set an example in terms of also making sure that we put on our masks, those who are very close to the MEC. I can see somebody is not on his mask there. Really appreciate it. Yeah, if the MEC is not on, but everybody's on the mask, we really appreciate. So that tomorrow we shouldn't be critiqued that they are running a Department of Department of Health, but they don't put on masks. We're on YouTube, colleagues, and all of us, including honorable members. Everyone who's going to speak, you must show yourself. I must be able to see that really you are in a meeting in a formal way. Thanks very much on the matter. Honorable members, there is the issue that the MEC has just spoken to, the outstanding issue that we have raised the department. Is there any take on the matter, honorable members? Honorable members, Honorable Muyamani, first hand, Honorable Libya, second hand, Honorable Manaha, tenth, and those are the three hands for now. Honorable Munama, Mami Yamani, sorry, and Honorable Munama, the last one. Honorable Mami Yamani.
Thank you, Chairperson. We take note of the response from the MEC, but what I wanted to check is the timeframes. If they may tell us about the time frame, or how long will it take for the administration to deal with the matter. Thanks, Chair.
Thank you very much. Honorable Libya.
Thank you very much. Blessed morning, honorable members and team Department of Health. Chair, I just wanted to reiterate on what Honorable Mamianani has just said now, alluded to now. Also to say, Chairperson, this issue has been dragging through numerous portfolio committee meetings. And then I would just like to make a quick suggestion to say, seeing that the department is on top of the issue, the administration is on top of the issue, and seeing that the matter has been outstanding and dragging for some time now, how about here, seated here in this meeting, we give the department a deadline to say, with regards to this particular issue, it's of paramount importance, Chairperson, and we must not be seen to be setting a wrong precedent. Let's quickly attend to the issue, close it off, and I'm glad the department is on top of it, but let's quickly set a deadline that will be adhered to by both the administration and ourselves as the portfolio committee. Thank you very much.
Thank you very much. Mama Naka? And Kanya will be the last.
Okay, thank you so much, Chair. I did hear the MEC very well. I would like to comment on this issue of Dr. Manamela. Like Honorable Livia has said, this issue has been dragging for so long, and they are saying that administratively they are dealing with the matter. I would also like to ask the MEC if whether Dr. Manamela has been updated maybe with any developments on whatever administration is deciding, because this issue has a psychological impact on the doctor that we're talking about. We would like the department also to consider that, because as the department, I heard her saying that she was busy with the MEC of Education trying to make sure that the family that has been affected by the suicide of their loved one is getting support. Dr. Manamela also need that support because we don't want to lose Dr. Manamela because of some other psychiatric conditions or like depression because of the issue that the department has created. We would like to urge the department to deal with the matter as a matter of agency and let them give us the deadline like what Honorable Munyamane has suggested, because this issue is affecting is affecting the doctor in question. Let's make it let's make sure that this issue is attended to as a matter of agency. I'm just repeating. Thank you so much.
Thank you so much, Dade Munama. And I've seen a hand from the department. I will give the MEC a chance to speak after that. Honorable Munama.
Okay, no, thanks very much, Honorable Chair, honorable members, Honorable MEC, and encourage our support staff. Chair, I just wanted to add my voice on the subject matter that, firstly, let me appreciate the efforts taken by the Executive Authority, the Honorable MEC, by addressing this matter, because it was one matter that was quite contentious. I think we must also appreciate the attitude that the MEC is part of us, and we mustn't be seen as if we are not representing the same constituency. And Chair, I just wanted to be upfront to warn also that about the separation of powers and the charges that has been laid against or preferred against a particular employee in the department. But I think, like they said, what is agent to you cannot be agent to some of us. I wanted us maybe just to propose a date that by Monday, perhaps, as the MEC has correctly said that they've addressed the matter administratively, that we get the formal feedback on the matter, and that I think it will go a long way in terms of our relationship with the department, because previously, as the portfolio committee, Honorable MEC, we felt being undermined, and that's one issue that I think we were still reiterating, that ours is not, we don't have any other ulterior motive than to ensure that the department provide quality healthcare services as provided in the Constitution, which is the supreme authority in the country. And that's our attitude and nothing else, Honorable MEC. That's our stand as the portfolio committee. And then we're looking forward, but also we want to commend the department, despite all these things, for getting an unqualified audit report. I think if we can work together, we'll be able to even to get a clean audit. But we can't get a clean audit or an improved audit opinion as long as there are some frictions, unnecessary undertones of saying that we are interfering in the department. We can't interfere, but we know our responsibilities. As long as you are citing us as the department to say that we are the ones who have caused these things, I mean, it means that the Honorable MEC must go and present before the disciplinary hearing. That's what we don't need as the portfolio committee, and we don't need us to go and present or adduce evidence in front of the disciplinary committee. That's the context in which I think we propose as the portfolio committee. But also, Chair, we wanted to state it up front, Chair, that I think generally the relationship of the department with other stakeholders is not good. And that's one area that I think, Honorable MEC, we need to fine-tune. But I think we acknowledge your commitment to ensure that there is a better conducive working relationship in the department that will enable us to ensure that we execute our responsibilities. We are not competing for any space, but we just wanted to be robust in our oversight. We don't want to be like other people that have to appear before the commission of inquiry. Because they were there, they did not raise issues as they see them, afraid of other things. So I think, Chair, now I'm happy by the attitude of the Honorable MEC in addressing this matter. I think it will solidify the relationship that we must have, not the relationship that will compromise how we entertain the reports that the departments come there. They must expect hard questions from us as the honorable members here that will not sugarcoat or romanticize issues as they come, because they will compromise our integrity as the public representative. I think that's my attitude, Chair, but I wanted to be upfront. Like Honorable Manaka said, we don't need to expect people to be subjected to psychological effects because of the type of the work that we are doing. And Chair, I propose that by Monday, if we can get a concrete submission in a written form, verbal as it is, we agree, formal representation by the department on the subject matter, and then as and when we meet, we'll see how to process. Because I'm raising this matter, Chair, if it's not amicably addressed, because it was an oversight, it will constitute part of the recommendations that we are making there. But the other issue, Chair, that we must also raise on this subject matter, Honorable MEC, we're not happy as the portfolio committee last time when the HOD was contradicting you in front of us. Just go back and resolve that matter, because that's not the type of the situation that you need. We need a united front when you meet with us. We go to your delegation. That's one matter as the portfolio committee I think we're going to process, whether, and thanks for complying with that, whether those powers were delegated or not. But we were not happy as the portfolio committee when you contradict one another in front of us. But I think we're appreciating that because you are part of us. If there are issues, you are at liberty to raise them with us, but we can't compromise our oversight and accountability as articulated in the Constitution. Thanks, Chair.
Okay, thank you very much. I was trying to get to myself unmuted. I saw a hand from the department. I don't know, Honorable MEC, before I make closing remarks on the amendment.
Yes. No, thanks, Chair. I think I was covered by Honorable Munam, because I was a bit concerned that the sensitivity of the matter, if we can go into the details and then condition now the mental challenges that the employee is facing live like we are now. I was just saying, if we treat that with that particular sensitivity, hence you would hear that I would not go into the details of the matter. But I think the way Honorable Munama has summarized to say you would be expecting a report on Monday, we will do that as the department, but to not to go further on discussing this particular matter, the sensitivity of the issue itself, and also protecting the very same employee that we should ourselves protect. So otherwise, I still reiterate the commitment that both our administrators who are here and I am towards making sure that we work together, and of course you're quite right, Honorable Munam. We would not have achieved this unqualified audit if it was not the hard work that these administrators continue. And it's expected that when people are working very hard, there will be areas where we will not agree how we see things. Not that there is undermining or there is disrespect, but people sometimes will see things differently. What is most important, it's for, at the end of the day, we need to sit down and find each other on any other matter. There is no matter that we can fail to resolve on our own. We should be able to resolve. You're quite right. If we work together and support each other, we will improve and move from this unqualified audit and towards even a clean audit. It is possible. And with the current team that I do have, I must reassure honorable members that yes, we will be able to deal with the matter. Even on the issue of that Honorable Munama was raising, I think the issue is there has been a misunderstanding between what I was saying and what the HOD has been saying, and we will clarify that particular matter to say, while the delegations have not been written to be delegated, but the SMS handbook has been used on this particular matter. So these are issues that we will explain to, like I'm saying, when people are working, the aim is to work and to deliver services. It's not necessary to be undermining the portfolio committee. So we will be able, even in future, we are still going to differ on the approach. I differ with them as my executive on a daily basis on how we approach things. We continuously differ. But what is important is we sit down and say, this is how we need to move forward, because the department that honorable members you are given the responsibility to oversee is a quite sensitive department. You would note that it's a very difficult one. It's very sensitive in its own nature. So the energy that we have, that I appreciate the support that you give us on a day-to-day basis. When you visit our facilities, I will not be in all facilities at the same time, but I rely on you, because sometimes when we are sitting internally, we'll think we are doing the right thing, but at times you always need someone from outside to come with a different view and be able to make you see that on this one, try to do things the other way. So otherwise, let me really appreciate and commit once more that we are committed towards the working relationship in order for us to fix this department, because without that, our strength, it's always in our unity. And I think that's what our premier always likes saying, to say, if you want to defeat anything, be united, continue to be fragmented. Thank you, Chairperson.
Let me see. And I think in the spirit of cooperation amongst ourselves as both the department and the portfolio committee, we'll wait for the word of the ABC. And I think I've briefed the committee on the MEC that I had an interaction with yourself on one-to-one telephonically, and you have assured me that the department is handling the matter. That brief I've given it to the committee. The committee wanted to get it directly from yourself, but be rest assured, we're in support of all the activities that we're trying to do, and we want to make sure that there is that synergy amongst ourselves, particularly yourself as the executive authority, and also being a member of the provincial legislature, but on a key mandate and key function as a member of the executive council, and ourselves as the oversight committee. I will appreciate, let me say that communique in relation to the matter, with its sensitivity, you hand it directly with myself on my personal email, so that we don't have leakages in terms of that information until it is fully processed. But we're giving you a due date for Monday, the close of business, that you deal with that matter. Honorable MEC, you might be aware that there are also other challenges in the department that I personally communicate with you, which need your interaction, and we really appreciate that in most cases when I talk and speak to your office, we get assistance and you quickly activate our personnel and deal with some of the issues. There are some of the negative issues. We don't want them also as a portfolio committee. That speaks to our department, because we're a portfolio committee of the legislature, but our key and most key, focus is on the Department of Health to see that it improves. From this unqualified audit opinion, be rest assured that the clean audit is just on the corner. As long as you, men and women who are there with you, will continue to support one another. And where we do wrong, we're able to correct one another in a manner that is professional. We're told that Mama Namela is just being released from hospital from where she was yesterday, because we want to inform you, Honorable MEC, that it's not that we are inquisitive about her. The family has created an open line with the portfolio committee, because they've been blaming us, but we've been suppressing them that this is a departmental matter, the department will deal with it. But we've got an open line with the family. They've just briefed us through our researcher that she has been released, and we are quite relieved. And we hope that through your intervention and the HOD, we'll close the matter and rest it and make it to rest. That's why I'm appealing MEC that any communique on the matter, it be directed to the chairperson alone for now until the matter is close to its finality. And it should be communicated between myself and yourself as the executive authority, so that we manage the information before the meeting on Tuesday. We should be having that response, so that on Tuesday's meeting, the committee is able to deal with it. But we really appreciate that we've moved from a laughing stock of the departments in Limpopo to an unqualified audit opinion with matters of emphasis. And I think our learned doctors and learned academics who are deployed who are hired in that department will deal with those matters of emphasis that the Auditor General has raised. And congratulations, MEC. Honorable Munama have done it in style. I thought we'll do it at the last when we are finishing. We want to appreciate that really you are making Limpopo to move. We are still going to differ on many issues, but be rest assured we're not differing because it's a point of difference. We are differing because we want to build a department, and this should be one of the shining departments in the country. There are very rare Department of Health in all provinces which have got a qualified audit opinion. And we want to appreciate Team Mhlongo, Dr. Mhlongo, Team Mhlongo, and Team Ramatuva for the good work that you've done. And bravo to the department. Number 4, that is second and third quarter reports. I think they are due. Not so long. We'll be having another session with yourselves on Tuesday, where we're a slot, and I think officially our administration will deal with that. But we just want to prepare you that even other reports don't have a problem. We are still going to give you time to make those particular presentation to the report, including the oversight report of the portfolio committee. It means Tuesday might be a fully chock-a-block today. With us with many reports that we must process and make sure that they go to the legislature sitting formally. So thanks very much. Honorable MEC, could we get a brief in terms of the APP and budget for 2021-2022?
Thank you once more, Chair, for again giving us this opportunity to present our APP. I think what I can indicate before I hand over to the HOD, it's we as you would remember when I presented the budget, we starting our year on a very painful note, on a negative note. Last year was a difficult year for us. While we were looking forward to improve, which of course we did improve, but however, the COVID-19 did not make life easy for us. Even in this particular year, COVID-19 is still with us. Not only is it affecting the health of our people, but you will understand that the economic challenges faced by our country today, it's really very, very difficult period. Because the all departments in all government departments, that is why we have been warned to say we must do most that we can with the little that we have, and I can indicate that it has not been easy. That is why we are going to see a lot of mental health care cases that we will have to be dealing with as the Department of Health for many other areas that are being affected, because we are depressed because of these challenges that it's facing all of us. So our wish list, I know you will see some of the areas where as politicians we put high expectations and high demands to our administrators, and unfortunately we at times are not able to meet those demands. Just to give an example, that you know how passionate I am with the issue of clinics operating 24 hours. And I can tell you, we have seen a lot of regression on that particular area. I must just say it up front, mainly because of the very same challenges we are saying. Minister Mboweni came up with the regulations that protects previously you would be penalized when you retire early, but there has been those relaxation. And what I was discussing with the HOD even yesterday, that what we have noted is that actually the people that we are currently losing, who are resigning in numbers, just in Pani on Monday, 20 professional nurses who are between the age of 59 and around 62 have handed over their resignation. And most of them, their reasons is that we are really exhausted. We've been working for a long time, and COVID came and finished us. We've seen our colleagues dying of COVID, and we cannot take it anymore. So you're continuously bleeding on the other side in terms of those nurses that you must use to run your 24 hours. On the other side, you are told you can't appoint, you can't fill in any vacant post, you can't fill in that post. So that's the dilemma that we are finding ourselves in. Hence, you see that there would be such regression in areas like those ones. So it is one of the issues that it's very close to my heart. Chair, yesterday you called me of one of the challenges, and I can tell you, when investigating that challenge of a woman delivering at the clinic gate, it's exactly that. They are left with one midwife in that clinic who take calls, and she can't take calls every evening. We need to replace, we need to look for new people, but people are afraid to. On the other hand, as the department, we are told our structure is bloated in terms of administrators, which is true. And administrators, I know I'm live here, I will be killed after saying this, but administrators, because they are not in the call phase of COVID, they do not see this as an opportunity to retire early, because some of them can work from home. When you are 62 and you are an administrator, you can have your computer, your gadget, you work from home. You don't need to work to go to work. You don't need patience. So where we really are bleeding currently, it's where we are in dire need. We are losing the call phase because they are exhausted, they are drained. COVID-19 is not making their life easy. But where we are saying we could do sometimes without some of these employees, they are not taking that advantage of. So that regulation might have been come in handy, but in our department, Chairperson, I must indicate it has not necessarily come in handy. I just got an indication from the HOD. She has directed our head from strategic planning, and Tate Molokwane, he is going to take us through the APP. Tate Molokwane, member of portfolio committee. Listening.
Before that, Honorable MEC, you have raised an issue of us losing some pupils in different schools. Could you just observe a moment of silence for 2 seconds? Just in that, in honor of the... May their soul rest in peace. Thank you very much, MEC. We can get the Molokwane continuing through your delegation. Thank you.
Good morning, the HOD, good morning, and to the rest of the executive management team of the department, good morning. And I would also like to pass my greetings to the Honorable Chairperson of the Portfolio Committee on Health, as well as the Honorable members of the Portfolio Committee. I will be taking the Honorable Chairperson through the annual performance plan and the budget for the department for the 2021-2022 financial year. Chairperson, I hope all in this meeting are able to see the presentation.
Yes. Loreto, can you flight it on the screen so that members could follow?
Okay, from our side, I'm assured that it's been flagged. I was checking with the honorable members if they can see it and be able to follow.
Thank you. We're following. There it is. We're following.
Okay. Thank you, Honorable Chairperson. The presentation outline is as follows. We look at Program 1, which is Administration, Program 2, District Health Services, Program 3, Emergency Medical Services, Program 4, Provincial Hospitals, that include regional and specialized hospitals, Program 5, Tertiary Hospitals, Program 6, Health Sciences and Training, Program 7, Healthcare Support Services, Program 8, Health Facilities Management. And in terms of the overview, the department is basically underpinned by 2 impact or change areas that we would like to realize by 2030, which is increasing life expectancy, which we shall do through eliminating avoidable and preventable deaths, as well as promoting wellness and preventing and managing illness. And the second underpinning impact area is implementation of the NHI, which we shall do through transforming health systems, improving on patient experience of care and mitigating social factors determining ill health. And then it's important, Chairperson, Honorable Chairperson, to indicate from the onset that our total allocation in terms of the budget has declined by an average of 0.4% over the medium-term expenditure framework, meaning that our equitable share has decreased by 3.8% from the 2020-21 adjusted allocation. And this basically demonstrates that the department is currently experiencing financial strain for the foreseeable future. And it is important that we make it clear from the onset, Chairperson, that where perhaps baseline versus the targets for 2021-22 seem to be low is because of this financial constraints that the department is facing at the moment. Then moving into Program 1 administration, Honorable Chair, we have allocated a budget of 291.4 million. And the next slide indicates basically the economic classification in terms of that 291.498 million on how it has been broken down in terms of compensation of employees, in terms of transfer and subsidies, and in terms of payment for capital assets. Then coming to the crux of it, Honorable Chairperson, it has already been indicated that the department has attained an unqualified audit opinion. And in the financial year 2021-2022, we intend on sustaining and attaining an unqualified audit opinion, Honorable Chairperson. And then in payment of our suppliers in 30 days, we'd like to have all our suppliers paid within 30 days in terms of us targeting 100%. And then we're looking at having all our institutions, 58 of 58 are realizing or having a credible asset register. And we intend collecting revenue of up to 222.9 million in the financial year 2021-22. As we progress to Program 2, Chairperson, which is the District Health Services, a budget of 13.7 billion has been allocated against this program, of which 3.2 billion is for community clinics, 612 million for our community health centers, 2.4 billion is for combating HIV and AIDS, and 6.5 billion is for district hospital services, 496.6 billion is for district management, 189.5 million is for community-based services, 81.3 million is for other community services, 3.9 million is for nutrition services. And the next slide basically gives the breakdown in terms of the 13 billion that is being allocated in terms of the economic classifications. Then into the crux of it, from starting with the primary healthcare services, and in stepping towards realization of the NHI, looking into primary healthcare services, we'd like to improve on the patient experience of care satisfaction, and we're targeting 65% in terms of that. We'll also like to realize and increase on our clinics that obtain the ideal clinic status rate, which we would like to have that or have 45% of our clinics being ideal by the end of the financial year 2021-22. And in terms of district hospitals, again, looking into implementation of NHI, Chairperson, patient experience of care rate in terms of district hospitals, we're looking at achieving 70%. And also in addressing issues of litigations, Chairperson, we're looking at having all the severity assessment code 1 incident reported within 24 hours at district hospitals being at 100%. Patient safety incidents, case closure rate at district hospitals, we also like to have that at 100%. Chairperson, in increasing life expectancy and looking into district hospitals, we'll also want to see a reduction in maternal mortalities in our district hospitals, and we envisaging to realize 100,000 live births in the financial year 2021-22. And in terms of under 5 mortalities, looking into the diarrhea case fatality rate, we're targeting a 5.5%. In terms of fatality rate, talking to pneumonia here, Chairperson, Honorable Chairperson, we're targeting a 3.5%. In terms of severe acute malnutrition, fatality rate still under 5. Honorable Chairperson, we're targeting 7.5%. And in totality, looking into under 5 against live births rate in under district hospitals, we're looking at 1.7 per 1,000 live births. Then we'll proceed to the sub-program HIV/AIDS, which is the HAST program, Honorable Chairperson. And Honorable Chairperson, in addressing issues related to youth being HIV positive, we're looking at the HIV positive 15 to 24 years, that is excluding the antenatal care rate. We're targeting 8%. And then in terms of Honorable Chairperson, achieving the 1990 strategy, looking at the adults and children, adult remain in care, that is the antiretroviral treatment, adult remaining in care. We're looking at achieving 90% by 2021-22, and that is also the case in terms of antiretroviral treatment, child remaining in ART. We're also looking at 90%. And then in terms of load suppression in regards to adults, we're also looking at 90%. And in terms of load suppression, looking into children, we're also looking at 90%, Honorable Chairperson. And in improving access to TB and TB XDR treatment and outcomes, Honorable Chairperson, we're looking at the loss to follow-up rate in terms of TB patient that will be at 8%. And then in terms of treatment success rate for all DSTB patients, we're targeting to be at 79%, Honorable Chairperson. And in terms of TB, rifampicin-resistant MDR, pre-XDR treatment success rate, the department is targeting to be at 63.2%. TB XDR treatment start rate, the department is targeting to be at 100% by 2021-22 financial year, Honorable Chairperson. As we progress, Chairperson, still remaining under Program 2, Sub-Program Mother, Child, Women, Health and Nutrition, MCWH and N, in improving family planning, Honorable Chairperson, looking into the couple-year protection rate, the department is targeting 55%, and in addressing issues related to teenage pregnancy and reducing it, In terms of looking into the delivery of 10 to 19 years in facility rate, Honorable Chairperson, the department is looking at achieving a 40%. And in addressing issues related to attendance of antenatal care, which also points to maternal mortality, reduction of maternal mortalities, Honorable Chairperson, we're looking at 70%. And then mother postnatal visit within 6 days, we're also looking at 95%. And then neonatal, that is less than 28, those kids less than 28 days, death in facility rate, we're looking at 12 of 1,000 live births. And then in improving maternal care, Honorable Chairperson, also we, in terms of live birth under 2,500 grams in facility rate, we're looking at 12 per 1,000 live births. And infant PCR test positive at birth rate, Honorable Chairperson, we're looking at 0.6%. And in decreasing mother-to-child transmission, that is 0.6%. And in coverage of children fully vaccinated and increasing that, Chairperson, under 1 year old, we're looking at 75%. And then measles second dose coverage, we're looking at 80%. And in improving health at childhood through vitamin A supply, we're looking at a coverage of 40%, Honorable Chairperson, in 2021-22 financial year. And the last sub-program, Chairperson, which has to deal with the disease prevention and control under Program 2, in reducing mortality due to malaria, we're looking at a case fatality rate of less than 1% in 2021-22 financial year. And from the perspective of urban response under 50 minutes rate, we're targeting 74%. But within 24 hours rate, we're looking at 100%. Patient safety incidences, case closure rate, the regional hospitals, we're looking at 100%. Maternal mortality, reduction of maternal and child mortality in regional hospitals, Honorable Chairperson. From the perspective of maternal mortality rate being reduced, we're looking at 111 per 100,000 live births. Diarrhea fatality, case fatality rate under 5, we're looking at 1.2%. And severe acute malnutrition, also pneumonia case fatality rate in regional hospitals, we're looking at 2.1%. And then severe acute malnutrition under 5 in regional hospitals, we're looking at 11%. And then in total, in terms of death under 5 years against live births rate in regional hospitals, we're looking at 2.3 per 1,000 live births. Now moving into specialized hospital within Program 4, patient experience of care satisfaction rate in specialized hospitals, we're looking at 70%, and both the severe assessment code incident reported within 24 hours and patient safety case closure rate in regional hospitals, we're looking at 100% on both the indicators, Honorable Chairperson. I have pleasure, Honorable Chairperson, again of presenting to the Portfolio Committee the budget Program 5, which entails of tertiary hospitals. A budget of 1.7 billion has been allocated to this budget program. And the next slide, Honorable Chairperson, shows the economic classifications, which I'm not going to delve much into. And then in terms of the crux of what will happen under tertiary hospitals, Honorable Chairperson, yes, we're still going to be looking into issues related to implementation of the NHI from the perspective of patient experience of care, which will be at 80%, and then 100% in terms of PSI, as well as patient safety incidence case closure rate, Honorable Chairperson. So from the perspective of reduction of maternal and child mortality in tertiary hospitals, Honorable Chairperson, in terms looking into maternal mortality in facility ratio, the target is 455 per 1,000 live births. In reducing under 5 mortality rate from the view of diarrhea case fatality rate, the tertiary hospitals, we're looking at a target of 5.4%. And then pneumonia case fatality rate in tertiary hospitals, we're looking at a target of 10%. Severe acute malnutrition case fatality rate in tertiary hospitals, we're looking at 7%. Death under 5 years against live birth rate in tertiary hospitals, Honorable Chairperson, we're looking at 4.6 per 1,000 live births. As we move into budget program 6, which is our health, science and training, a budget of 650.9 million has been allocated to this program. And 115.3 million is to maintain the medical students sent to Cuba, 201.8 million for funding of lesson training colleges, 333.8 million for other health professional training and development, including bursaries, 4.8 million out of the total of the 3.8 million is allocated for EMS college and training, Honorable Chairperson. So the next slide, basically, Chairperson, gives a picture in terms of the economical classification on how the budget has been classified economically in terms of the particular program 6. In program 6, Chairperson, we're looking at sending five learners studying for Bachelor of Health Sciences in Emergency to our universities in the financial by the end of the financial year 2021-2022. And as we move into program 7, Honorable Chairperson, a budget of 707.5 million has been allocated to this program. And the next slide also indicates the economic classifications in terms of the 707.598 allocated to the program. And then here, Chairperson, key was to look into the increasing availability of essential medicines. And we'll start at the depot. In terms of the depot, we're looking at having essential medicines available at 73%, and availability of essential medicines in hospitals, we're looking at 90%, and availability of essential medicines in primary healthcare facilities, we're looking at 90%. 90% for both hospitals and primary healthcare is mainly because this is where patients visit the hospitals, and 73% in terms of the depot. The depot is not supposed to be storing a lot of medicine to be found in our clinics and hospitals, Honorable Chairperson. The last budget program, Honorable Chairperson, it is program 8, which is in terms of health facilities management, and 1.3 billion has been allocated to this program. And the next slide indicates the economic classification in terms of the program. And then in this program, Chairperson, we look at the total number of health facilities with completed refurbishment. And we're looking at the percentage of planned health facilities with major refurbishment, Honorable Chairperson, which our target for the financial year 2021-2022 is at 5%. Honorable Chairperson, it was my pleasure presenting to the honorables the annual performance plan for 2021 and the budget allocated against this plan in the financial year 2021-2022. I thank you. And I'm handing over back to the Honorable MEC.
Thank you, Mtate Molokwane, Chair. I would hand over to you unless there's any addition from DDGs and HOD. Yeah, they are all covered. I think that is all from us. Thank you once more, Chair.
Thank you very much, Honorable MEC, and thanks to the collective leadership of the administratively led by the HOD. We really appreciate the presentation. And I'm glad that it seems Dr. Mhlongo is continuously building layer of leadership in the institution, and we want to appreciate that we also delegate to other colleagues in the SMS to continue making the department to shine. Thanks very much, MEC, and your team. Honorable members, there is a presentation by the department. It is now on our shoulder as the portfolio committee to engage on the presentation. Honorable members, can I see your hands? Honorable members, you can decide to take a program per program, or you can decide to speak to each and every program one by one in any order that you think is best interest. I see. Can I take hands? I can see the first hand, Honorable Mlama. Honorable Mlama, and let me see other hands. Other hands will come when time continues. Honorable Mlama, can you break the ice?
No, thanks very much, Honorable Chair and honorable members. We want to take this opportunity to welcome and appreciate the presentation I think, Honorable MEC, we still have good people in your department. I think I'm quite impressed about the presentation that has been made. But I think, Chair, I just wanted to zoom in on the issue on is a cross-cutting matter on COVID-19, the 1.9 billion that has been that will be used for this. If they can clarify us about like the MEC in her budget speech make mention of that, but I don't see how does it find expression in your APP. This one here, the COVID, the rollout. But the other issue that they must clarify us on the very same matter is on the rollout itself. How many vaccine centers do you have in the province? Because previously we only heard about your Polokwane and your Mankweng, and we're not told about what is happening with the others that you were saying they are there in the province. That's one matter. The reason why we are raising this issue, because this is one of the contagious issues in the country about the COVID. And if perhaps we have that one as part of the key performance indicators, it will assist us to make a monitoring on it. How is it being rolled out and so forth. And the other thing, Chair, is on the appointments. I think it's not clear on the targets of the appointments whether we are going to feel like the issues of the porters. We have been making these rounds in these hospitals, and it was very key that in all the mortuaries that we have visited, there is an acute shortage of porters in the hospitals. In fact, the people, some admin staff are being utilized for these purposes, which I think is something that the department has to deal with. Chair, also the issue of the every year MEC, and in your budget speech you have alluded to that, the issue of the acquisition of the purchase of ambulances vis-a-vis the training of the EMS. Where is this budget going to be sourced from? That's one issue that I think we want to get an assurance from you, so that as and when you prosecute your responsibility, at least we know that is an area that I think we will closely monitor. The other issue that I think it was more of a concern also, Honorable MEC, was the psychiatric hospitals, but also the general hospitals. We see that you have a budget there, but these hospitals is a problem that I think if it's not adequately addressed, and we don't have the programs of how do we then address them, because they are just treated like any other patient, and which is a problem. They don't have mounted beds, and also their conditions in the hospital is not as it's supposed to be. And Chair, I think we are also worried about the maintenance of all the health facilities in the province. I see that you have the budget there, 1.11 billion, that the department wanted to deal with the minor maintenance. But generally, I think the department must just provide us with a plan. How are they going to deal with this? Because some of these things you can't afford, MEC, that you have a broken window for 10 years, or a toilet or a ablution facility in in a clinic or a health facility which is not working for 10 years. Those are the minor things I think that has to be addressed. And if we can get an assurance whether that maintenance, because our feeling, Chair, is that there is what we call the fiscal dumping by the department, perhaps more especially on Program 8. As and when the year comes to a close or to the end, that money is being dumped to the districts. And we wanted to get the report from that. How much has been allocated to the district, more especially in March or February, and what was purchased with that money. We wanted that, Chair, because it seems there is a poor planning on that part, and that thing, if it's not carefully treated well, the reason why we need the report, Honorable MEC, we don't want people to just buy things for the sake of spending the money, but there should be a value for the money. That's why if we can get that report, the money that has been transferred to the districts and what has been purchased and whether those things have been delivered to their destinations as expected, as per the procurement plan. But I think, Chair, in finalizing my contribution, if we can get, as much as we are approving the budget, I think one of the documents that will be requiring, Honorable MEC, is the procurement plan of the department, because it will assist us to monitor the budget. And on the issue of the issue of the unwanted expenditures, I think fruitless and wasteful, we are doing quite well there. We want to commend you on that issue, keep it up. But also we are more interested about the accruals. You know that the accruals is one of the things that has been bedeviling this department. If we can get a report, how are you handling them and how much have you already spent on the accruals? I can also see that you are Metico Legal, you are doing quite well there. But I think if you can get those things to some extent on a quarterly basis, as and when we report to the legislation, we get the reports, we'll be able to monitor what is happening in the department. Because it's not just a malicious compliance that we want to have these things and approve them from there, we leave it like that. And I think in a nutshell, Chair, those are my inputs, and thanks very much.
Thank you very much, Honorable Nama. Any take, Honorable members? Any take, Honorable members? No, it's fine. Let me take some of the issues. I think in the same breath, Honorable Nama, we are acknowledging the collective effort of the department in dealing with some of the issues that they've raised. You might have seen that in terms of the budget, particularly on equitable shares, the department speaks about an appropriation of roughly around 18 billion and an estimate expenditure of around 17 billion. And on conditional grant, which I think it came at the right time, I think it's a conditional grant on mental, is it on mental health care, if I'm not mistaken. That also will speak with some of the issues that Honorable MEC spoke to, that we had around, I think it's around 3,920,000. And overall, our total budget being around 22 and our estimate being around 21. I think the basic issues that one wants to raise is in relation to the budget that, I mean, the speech that the MEC spoke about in the legislature. Because even if we're on COVID, she reported on about that we'll utilize around 1.9 billion on COVID. And those activities in terms of COVID, they were not fully disclosed. It might be that we're in mid period, fully disclosed within the APP, and I think we need to get a hint by the department why they were not disclosed. If it came prior the APP being adopted, what could have been the next move in terms of making sure that they're disclosed? I think we're doing good on medical issues that Honorable Mnama spoke about, but on the issue that relates to compensation of employees, we're still sitting at about 75%, whereas we still have got a vacancy rate, particularly in clinics, at about 37%, and also for administration at about 45%, while we're struggling in terms of maintenance and also equipments. I think the MEC spoke to an issue of an ideal clinic. We've got 61 of the 413 clinics that we have in the province. 61 of them are on a 24-hour cycle, whereas vis-a-vis the target, because the department put a target of 124. And I think we should get an explanation how best can we move from that 61 to a possible 124 for an ideal clinic. We are aware of the COVID budgets that took much of our resources, but what are the mitigating factors that we will put together to make sure that we reach that? Because to me, some of these issues are non-negotiables, and we can't compromise funding on issues of non-negotiables. We'll speak on the issues that Honorable Mnama spoke about in terms of your administration. We're quite happy that we in terms of irregular expenditure, as we've got that unqualified audit opinion, from 17.1 million, we've reduced from 54.2 million. It means we had a very huge reduction in terms of irregular expenditure, which is a positive sign. But it doesn't speak to our revenue collection because it still shows that various systems were not procured in the past in addition to the funding, and we're struggling to make sure that we get that particular funding. And to me, the contingency liabilities of around 10.7 billion, what are the plans to resolve some of these particular issues? The same thing on administration. I think you spoke about on the third quarter. Honorable Mnama spoke about accruals. The question would be how much accruals in the department is the department carrying over from the previous financial year, so that we are able to know exactly what is it that we are working on, and if our APPs, whether they've got detailed information in terms of employees who should be appointed, who particularly who will be targeted for employment. Honorable Mnama spoke about porters, and also the issues of filling other vacancy posts which are key and fundamental in the department. On program 2, I think you tapped on issues that relates to your district health, which we are very happy in terms of reducing medical legal court cases, which is it's a sign in a positive direction. It means we are employing correct people within those particular district facilities, and it really shows that the plan of the department is working to our advantage. But the issue still remains that we fail to meet the ideal clinic status at those particular districts. And if we could agree that even if our target were at 61 and our target was 124, what is it that we put as a target for each and every district to say, at least if this district can increase by 2-3, it makes a composite of the entire province. Because we need to also to see ideal clinics being developed in all the districts. It mustn't be that one district, because it's predominantly in an urban area, most clinics are on 24/7. We also need those services in our rural areas where our people find themselves in. I might also raise this issue, Honorable MEC, that we have got also a clinic in, I think it's Mutwaning, in the area of Skukuni. I think we will also request that you do a report on that, but I'm just raising it because it's where usually incidents happens. You remember that clinic is where our buggy disappeared. I think yesterday or the day before yesterday, there were some incidents there with the security company and people closing the gates of the clinic. It's something that we've just picked up, which really shows that for us to achieve an ideal clinic in a rural area, it might cost us severely. Now, those are some of the issues that we need to check with yourselves. The other issue on program 3 on your EMS, I think this one is key and fundamental to me, that the Premier and the MEC have announced the purchase of 20 ambulances, 13 perimedical responses vehicles, 15 planned patient transport vehicles, 1 bus year review, and also our partnership with the University of Limpopo, and more EMS personnel will be trained. How far are we able to say in terms of this particular APP will be able to deal with those things? APP, however, doesn't reflect these plans and how we're going to make sure that we're able to deal with some of the things. I'm aware I got a brief from the MEC, but we also want to get, that agreement that is there in terms of services of our ambulances, because I think we're letting being failed by the national department or any agreement that has been entered with by Treasury and the service provider, because an ambulance can be treated like the same as a vehicle of a pool car of the office of the MEC, like the car that is used by either a messenger. It can be treated the same. Because an ambulance is an emergency, it always available. We just want to understand how will this impact negatively on our service delivery. I think the MEC gave me a hint on some of the issues, but where should we unlock as a portfolio committee? Because some of the responsibility of us as a portfolio committee is also to unlock areas of difficulty that the department is facing. On program 4, you spoke about your provincial and tertiary hospitals. The department targeted 70% of the provision of quality healthcare service in our public health service, despite achieving 80. What made those wonders? We need also to be informed to know your target was 70, but you've achieved 80. It means you overachieved. Therefore, it means there are some of the things that we can do with the little that we have in the department, as the MEC has just said. The issue of program 6 on health science training. I think you have allocated around 105 million for your bursaries and 237 million for nursing colleges and 245 million for other training. How best are they going to help in relation to your APP, particularly the issue that you raised on page 74 on your APP? To say there was no mention of plan to train nurses and other categories of the health professionals, whether we don't want to continuously train amongst the competent staff that we have. But I've seen a program whereby some of the specialists that the department has taken for training, they came back, they're still servicing our people. Whether that can be also be part and parcel of that. On healthcare and support, I think the issue of the warehouse, Honorable MEC, and also the depot, and the 73% medical availability at the depot and the 90% in hospital and 19 clinics. We're quite grateful because we're able to, at least there you've stabilized, but the issue of the depot is still an issue that we believe should be addressed in relation to also these APPs. As for facility management, I think there you were able to speak to it, and we really appreciate. But the issue is that the completion of infrastructural projects, particularly those that are internal, that we're doing ourselves, or are we still having the same problem with the national department on some of our infrastructural problems? In summary, MEC is that those are some of the issues that we believe that we should get clarity on. That the plans in the MEC speech, which she spoke so passionate about. We find that they're not in the APP, like your EMS issues. The issue of low budget to achieve an ideal clinic. If we agree that on an annual basis, on our MTF period, if we say 10 clinics and we distribute them two per district, at least it will take us somewhere. But if we don't have any budget to deal with an ideal clinic, I don't think we'll ever achieve the 124 of our target while we're still at 61. It will be a pipe dream and it will take us many years. And those clinics are key and fundamental to our rural masses. And to me, as the MEC is quite passionate about that, we should also try to continuously, at least on an annual basis, if we have got a particular target, we increase it to make sure that we reach that target. Those are some of the issues that I think Honorable MEC, your APP spoke to. The new conditional grant on mental health, I'm very happy and positive that it will help a great deal to our facilities in the province. And I think but the other issue, MEC, is that on your APP, you sometimes put low targets, but your achievements are extremely high. It worries me that we should always strive for new heights. Even if we are putting low targets, we reach extremely high achievements. To me, it shows the work that has been done by the department. Therefore, it means that we can still target, put them at a higher level, even if we know that our achievement will be at that particular par. And the issue of the target for vaccination, I think the rollout program, MEC, will come separately from what we have in relation to the rollout program on vaccination, even though we're at a lower level due to circumstances that we find ourselves as a country. Now, those are the issues that I thought I'll raise in addition to what Honorable Mlama said, and we believe that the department is in capable hands to deal with some of the issues. Before I close, Honorable Lebia is there to also raise some of the issues and that clinic MEC is a Mutwaning, if I'm not wrong. I think Masono, is it Mutwaning in Ephraim Mohale? If I'm not wrong, yeah.
Yes, Mutwaning clinic in Ephraim, Honorable Chair.
Yes, I think it always have incidents, and we think we should, and where we're told that even security personnel take around 2 months, 3 months without being paid, whereas the department, you have paid the service providers. It compromises the security of our properties, and that should be looked into, because if a service provider is not paying his or her employees, it affects negatively our service delivery as a department, and also makes our work difficult as a portfolio committee. We don't want to rush to institutions where we think things could have been better handled, but there is somebody there who doesn't, he or she, do a work. And I believe the HOD already has got a report in relation to that, because district heads should be able to report any incident even before formal written reports are sent to the department. Honorable Olivia?
Thank you very much, Chairperson. I think it will be very beneficial if we can also join in with receiving this particular well-detailed report as reported by Mr. I just missed his name, but he did his job very well. I think that is worth applauded. But suffice to say, in addition to what we have just raised, Chair, it is very critical that the Honorable MEC reiterate on Program 6, because there's a budget there allocated for Program 6, Health, Science, Training, but it doesn't say a lot with regards to the allocated budget. If it can be well detailed and comprehensive, it will assist, Chair. And also to say on the issue of COVID-19, Honorable Chair, COVID-19 is very well with us. There's a surge somewhere outside of the country. We wouldn't want to see that happening here in South Africa or here in our province in particular. But if we can have a well-detailed report with regards to the COVID-19 budget, that will also assist. Also, something that is very, very, very close to my heart, Chair, is the issue of the infrastructure in the clinics and hospitals, whereas there's been money allocated from the previous financial years. Could we be privy to a report of some sort of how, in terms of infrastructure maintenance, how has it been utilized and how did it work? How did it assist? Because, Chair, one, if the infrastructure is dilapidated or people that are meant to go there and assist to upgrade the infrastructure for the benefit of the people of Limpopo are lacking in that department, whereas there's budget allocated for that, it will not be doing justice to the citizenry of the province. So that is very important, Chair, as and when they are unpacking some of those issues that we have raised, could they also zoom on the issues of infrastructure maintenance? Because in one of our oversight visits, Chair, you would remember very well the district are mentioning issues to say there's nothing we can do. Hence, Honorable Manama, you are saying there's a window that has been broken for 10 years. If you ask them, why are you not fixing the window? They'll say, no, we must wait for the department to send somebody for us to fix that particular window. Some of those things are red taped in their own nature. So if we can get a report based on that thing of infrastructure, it will also assist in terms of us moving forward as a portfolio committee. Thanks very much.
Thank you very much, Honorable Libya. Is there another honorable member want to make something? Well done, Honorable MEC. We can get clarifications on some issues that have been raised.
I've got them. Yeah, thank you, Honorable Chair and honorable members. Let me welcome all the inputs and clarity-seeking questions. I will therefore request the HOD to take us through the responses, and then we will then add if there are those that are missing. HOD.
Thank you very much, MEC, Chairperson, and members of Portfolio Committee. I'm just going to request the team to respond on the issues as raised, starting with the CFO on the financial issues that were raised, followed by the DDG of the branches on the specific issues that were raised in the APP. Before we do that, I'm just going to request Mr. Mulukwane to align the issue of the APP with the operational plans, and then we can then proceed. Thank you very much, Chair.
Thanks, HOD, Dr. Mhlongo. Honorable Chairperson and honorable members, in regards to the annual performance plan as per the framework for development of annual performance plans, basically what the annual performance plan would seek to achieve is to ask a question, what? And in the what question, it means it will not almost get to a 3-feet level in terms of outlining in detail how the issues are going to happen. But in getting closer to the 3-feet level where service happens, we then, and in line with the framework for development of annual performance plan, as approved by the Parliament in 2018, we then have to develop as the department an operational plan that then gets the annual performance plan closer to implementation, which then asks the question how. And then in answering the question how, in line with the operational plan, which then aligns itself through the output statements that are in the APP, it then gives in a detailed format, and hence it's a bit of a longer document than the annual performance plan, and gives in detail what will be happening in each and every program, and also clarifying in terms of the activities that will be undertaken by the department and the responsible people that will be in charge of those activities, in getting the APP closer to implementation. So what we're saying basically is that the APP almost fly at a bit of at a higher level in terms of it focusing on much of the strategic issues, and the operational plan then operationalize what is contained in the APP to give it a shape in terms of how things are then going to be dealt with in the particular financial year under review. Thank you.
Okay, thank you very much. Maybe just on your side, there was an issue of the targets that we set lower targets and we then get to overachieve. I think it's around the area of vaccination. If you can just address that before I hand over to the CFO.
Thank you, AJOD. Honorable Chairperson, in terms of targets at times, or perhaps let me say performance being higher and then targets, as we demonstrated in the annual performance for the 2021-22 financial year being lower than the performance historically achieved. It is key for me, Honorable Chairperson, to indicate to the honorable members that as I indicated in the second slide, or yes, I think it's the second slide, Honorable Chairperson, that the department is faced with financial constraints at the moment. Our budget in real terms did not increase. So then we need to be considerate in terms of the targets that we're going to set, if they will be indeed, when applying the SMART principle, but mainly looking into the R. I mean, are we being realistic in terms of achieving those targets if we've got to pull the R out of the SMART principle? And that's the key question that we've got to ask ourselves, Honorable Chairperson, as the department. And in doing that, hence, in other instances, as I outlined and when I started presenting, that there will be indicators where performance will historically look seem to be high, and the intended or envisaged target be lower than the historical performance. And basically, Honorable Chairperson and honorable members, that's because of the reason that's related to financial constraints that not only the Department of Health and Limpopo is faced with, but the country at large is in an economic crisis, and leading to all the budget cuts that we've experienced from the previous financial year up to where we are, and still envisaging perhaps some more of the budget cuts as we go forward, Honorable Chairperson.
Thank you. There is also some of the activities that as a department we do in collaboration with partners, and those partners are funded through various funding streams, which has got nothing to do with our allocated budget as a department. From a planning perspective, we don't know who are the partners who may come in to assist, and their budgets are not accounted for in the budget that we are tabling before the Health Portfolio Committee. But when it comes to the activities in terms of actual achievement, if it's about immunization or vaccination of children, if we have worked with partners, still record that as those that have been rendered to the children. But obviously, in terms of the performance plan that we were presenting, it only talks to the resources that are within our control. So that is why in some areas you might see our targets, we can only be sure of the resources that we have. But in terms of actual performance achieved, we disclose everything, and we do put an explanation or rather comments to say the overachievement is as a result of other partners, and that's what is normally reflected in our annual performance plan when we report back. I will then hand over to the CFO to deal with the issue of the COVID budget and the accruals and all the other financial related matters.
Thank you, HOD, Honorable MEC, Honorable Chairperson, and Honorable members. Good morning, and thank you for the opportunity. Let me start with the issue of the budget allocation, looking into the equitable share as well as the conditional grant, including the COVID-19 budget allocation. Let me indicate to the honorable members that for the current financial year,
the budget has been reduced by minus 2.8, and that clearly indicates a movement of, almost $1 billion from 22.6 to 21.9. And which is, very much, detrimental to the department because it clearly indicated that there was no growth. Over and above that, there was a reduction. Let me also indicate that due to, the financial constraints that we are all aware of in our country, the department was expected to reduce its budget by almost 3 billion. And a further cut, which was, instructed later on to say we need to make a provision for the COVID budget of amount of around 1 billion, which also was a reduction further on the 3 billion that we had, which now amounted to almost, 4 billion in the current financial year. And I would like to indicate that all that affected mostly compensation of employee. I heard the honorable members, wanted to know what is our recruitment plan. From where we are sitting, looking into the budget cut, we do not have any money that we could allocate to recruitment plan at this point in time, because we have affected, our, compensation of employee, and we have reduced it drastically so. But going to, the issue of the COVID-19 budget, yes, we do have, the 1 billion that we ring-fence, which was the reduction from our equitable share. We also received an additional 900 million from, our provincial treasury, which has left us with around 1.9 billion for the current financial year. And that is the budget that is, looking after anything that could happen from now until end of the financial year on that particular space. Let me also touch base on the issue of the accruals for the 2020-21 financial year. I would like to indicate that when we opened the 2020-21 financial year, the Department of Health had around 390 million worth of accruals, which includes also the payables. But as of now, when we are busy preparing to close our books, as well as preparation of the annual financial statement, we are sitting at less than 300 million, meaning that there is an improvement or a reduction of almost 100 million from the prior financial year. The other thing that I would like to also, indicate here talks to the issue of the internal control system that we have in finance, which, honorable members also raised to say, when we procure items, we need to ensure that those items have been budgeted for, they are part of the plan. I would like to also give assurance to say each and every year as a department, we are expected to develop and submit what we call the procurement plan to our provincial treasury, which is a complement of the APP in the department. And we also make it a point that as and when those items are procured, they follow due process that we have in terms of the financial management prescripts. Hence, when you look at the end of the last financial year, the department in terms of year to year or year on year, recognition of irregular expenditure, there was a serious reduction from 50-something million to 165,000, which clearly indicates that our system, are up and running, and they are able to, prevent unwanted expenditure. So on the issue of irregular expenditure report, we have noted it. We can be able to provide the irregular expenditure report, which will clearly indicate what the department is currently, doing with it. But let me also give you just, a snapshot of the situation at this point in time. I think, 5 years ago, we were sitting at around 2.7 billion worth of unwanted expenditure. And at this point in time, I would like to indicate that, we have managed to, reduce that irregular expenditure on a cumulative to around 690 million. And the broken down as follows: 685 is related to irregular expenditure and 5 million to fruitless and wasteful expenditure. And of the 685 irregular expenditure, 490 We have already, concluded the investigation, and the reports have been also submitted to our provincial treasury as well as others to the DPSA. We are waiting for condonment of those irregular expenditure, of which, if we happen to succeed prior to the finalization of our submission of the financial statement as well as the issue of the audit, our irregular expenditure might end up being less than 200 million in the year under review. As well as the fruitless and wasteful expenditure, we have investigated the amount which was still outstanding of the 5 million. It was around 350 million, of which we are going to make it a point that the investigations are completed before end of the first quarter of the current financial year. Coming to the issue of poor revenue collection, I would like to indicate that this particular area suffered a serious, dent as a result of COVID. As we honorable members would recall that during, the lockdown, as well as, when COVID was, at high, patients were not visiting our hospitals as they used to. And as a result of that, we couldn't collect because we normally depend on the patients, admin fees. So as a result of that, we are only looking at, areas which, we think in future will assist a great deal, which is RAF and a few, medical aids and stuff like that, which I think it will start to pick up going forward when this issue of the pandemic is under control. I think, in short, HOD, that is what, talks to finance.
Thank you very much, CFO, Dr. Tombo. Can you also touch on the COVID fund as a project leader as well?
Thank you very much, and good morning to honorable members. In terms of the vaccine, the first vaccination that happened was the phase 3B trial under the South African Medical Research Council with the name Sisonke. And because it's a research trial, it is fully under the SAMRC, and they then determine, as per their capacity, where and when the rollout would happen. They were in charge in terms of all logistics related to receipts of vaccines. We're referring to the Johnson & Johnson, and in terms of the management thereof, including the preparation of the vaccines, it was under their jurisdiction. The department was involved in terms of providing the platform, where because it was in terms of eligibility for receiving the vaccine under the Sisonke study, that you had to be a healthcare worker. Further, there was prioritization within the healthcare workers in terms of what they refer to as front-facing healthcare workers. So as the rollout was happening, there was stringent prioritization of those healthcare workers who had enrolled on the electronic vaccination data system and subsequently enrolled on the Sisonke electronic study. And once the Sisonke had looked at the enrollment, they will then determine those that were eligible in terms of their criteria. To that end, in the beginning of the Sisonke study, there were 2 sites that were accredited or approved for Sisonke rollout, and they were Pietersburg Hospital and Mankweng Hospital in Limpopo Province.
in view of the difficulty of accessing the two facility by all eligible healthcare workers in the province, in terms of distance from other facilities, and also the logistics of bringing eligible healthcare workers to the two sites. The department was of the view that this would create a lot of challenges, including denying or discriminating access to those interested healthcare workers merely by geographical location. So the department engaged with Sisonke at the local research Sisonke team, as well as the National Research Sisonke team and the National Department of Health, to resolve this matter and allow the Sisonke vaccination to also then be decentralized to other sites within the province using an explicit schedule. Eventually that was agreed to, and Sisonke then indicated per their capacity that they would only be able to roll out to one district at a time, and within that district they could only do one site at a time. So hence the schedule to other districts was that we would start with one facility and aim to do at least 2 or 3 facilities on specific days of the week as per the Sisonke research team's capacity. There was also agreement that since the research in the Elandsdorp, that in respect of Sekhukhune, that they also do it parallel smaller scale, because at the time the vaccines are also allocated to provinces. So it depends on the number of vaccines that are allocated to the province. So that is how then the Sisonke research took place. The last district that was being implemented from the 29th of March, if I remember correctly, was then taking place. Unfortunately, the second week of the Mopani rollout was interrupted as a result of the adverse events facing Johnson & Johnson, wherein there was a temporary halt of the Sisonke study as a result. That has now resumed as of the 28th of April, which is yesterday, and the rollout in Mopani is being completed, and thereafter the Sisonke team has indicated that they would be able to proceed with the Sisonke study. The department also received correspondence yesterday from National Department of Health to that effect. So that then the Sisonke team working with the department will proceed, and they've indicated capacity to be able to do 3 districts at a time. However, the numbers will still be determined by the allocated vaccines that they have. In terms of the mass COVID vaccination, which is under the auspices of the Department of Health, through National Department of Health, that we are also preparing for that. We had made a presentation to the portfolio committee in terms of the strategy regarding the mass vaccination rollout. That has remained in essence the same, and the teams have met in terms of local-based planning, and there are processes that have to be fulfilled in terms of the National Department of Health, looking at the fixed vaccination sites, which in Limpopo Department of Health, as previously indicated, is going to be our acute hospitals, i.e. 37 hospitals. We are excluding the specialized hospitals when we refer to acute hospitals. And then also from that hub and spoke, where we have outreach teams emanating from the fixed sites. So that planning through with the National Department of Health has been happening, and the department has been required to submit its plans to National Department of Health, which we have done. The registration of all the fixed sites, as I've indicated, has also been done. There are some legal accreditations that need to happen as per the Pharmacy Council in order for us to handle the vaccines, and that is in process and progress. And there are deadlines that the National Department of Health has provided in order for us to then work according to those, which we are doing. The minister has launched the electronic vaccination data system enrollment for the general public, looking at the phases that have been approved. And as the minister has announced, that the start point is those above 60, and locally that was launched also by our premier in the last weeks. And then subsequent to that will be the next eligible age group or category, which is the above 40 population. So all of those steps are being followed as directed through the National Department of Health planning. So the vaccination as per DOA be monitored through the approved systems. So hence this electronic vaccination data system, which the National Department of Health has implemented, to be vaccinated, to enroll through that particular system, and that is the system that manages the nation from point of enrollment up to and including the point of reporting. It is the only official system allowed to do so. There are other systems that are being put together to support the vaccination. These are existing systems. However, they are being expanded to also allow the management of the vaccination. One of them being the stock visibility system, which is also going to be used, which the vaccines are being delivered to the fixed vaccination sites as directed by the National Department of Health. So those are the things that are currently in place and happening in regards to the mass vaccination. So what the department is waiting for will be in terms of the allocation. The National Department of Health has indicated preliminary allocations, and that from time to time will be updated as per what they receive from the respective service providers, which is international service providers, and then we'll be guided from them in terms of what we are getting and when we are getting. The preliminary indications from their side is that we should be able to start in the second half of the month of May 2021. We have been requested to ensure that by at least the 4th to the 5th of May, we are ready for any eventuality in this regard. So that would be in terms of the COVID vaccination. In respect of the Ideal Clinic, just to indicate that we have been improving in terms of performance. We were in 17-18 at 34%. We did drop in the next financial year to around 14.7%. However, in the last financial year, which just ended 31 March, we have improved 5%. What I must indicate regarding the Ideal Clinic is that facilities do get assessed each and every year. However, one of the issues is that the assessment tool does change from year to year, and that also then affects the performance of the facilities. And so also in terms of one of the areas, which is medicine availability, certain drugs are assessed as part of Ideal Clinic. Now, if there is a stock out, that also then affects the outcome of the facility in regards to their Ideal Clinic status. So the approach that the department has taken is to have a developmental approach, because it will not be able to have a big bang approach to be able to have all facilities ideal, because that is also dependent on available funding as it relates to the various components that are in the Ideal Clinic assessment tool. In terms of the maintenance, indeed, the department has been looking at this item, and as indicated also in the portfolio committee, the budget available within the HFRG and how it is split. So what we have done as part of that is that we have met with all the technical service support managers, and we are making plans in terms of how we want this year to unfold. Last week we were with the team, and they are currently in the process of finalizing their year-long plans, so that we're able to have a baseline and agree on the key projects that we will focus on going forward. Part of that is also having a scheduled monthly plan for basic routine available, routine maintenance, like you indicated, broken windows, doors, and so on. So that is part of the planning that they are required to have. And what we have done to also support this process is an accreditation of hardwares, so that we alleviate the difficulty that was there in the past, which created a long turnaround time in terms of getting the required materials in order to attend to minor maintenance and general maintenance in the whole. So that has been done, and the districts were provided with funding in order to assist with that. That is also linked to COVID in terms of facility preparedness, and hence the planning around that, which has started looking at, so that we're able to allocate specific funds vis-a-vis the plans that are going to be put together and approved as part of this particular service. In terms of the 24-hour services, your concern is our concern, which we have also raised in the past. Unfortunately, some of the things that affect the 24-hour services is the attritions, which the MEC, Honorable MEC has alluded to, and also the security incidents that we have alluded to, as they do affect the ability of the various facilities to continue to render 24 hours, or in some cases there is regression after some of these incidents in terms of not offering 24-hour services, whether the 24-hour service is through straight shift or through an on-call system. So those factors do affect whether a facility would be open 24 hours. Over and above what you have alluded to in terms of the infrastructure, which we are also aware of, in some cases relating to alternative power, which we are working on as part of the planning that I've indicated before just now. Honorable Chairperson, that I can respond to at the moment. Thank you very much.
Thank you very much. It was quite a detailed response, and we really appreciate. Is there any other member who might have been left in relation to responses, so that we're able to give the Honorable MEC time to do the roundups in relation to all the presentations as done by the department, and I'll do the closing remarks, and we allow due processes to continue. At least we are 2 hours, 55 minutes. We're 3 hours in the meeting, and it really shows the dedication and commitment that colleagues have. Any other issue, Honorable MEC, your parting shots in terms of remarks?
Just before I give the closing remarks, I think there's one DDG for tertiary. There were questions on the where I think she need to take us on those. Dr. Ndoma.
Oh, yeah.
Thank you, Honorable.
Yes.
Yeah, thank you, Honorable MEC and honorable members. That is under Program 6. So we have an allocation there for training, and here we are referring to the students, the EMS advanced courses, as well as the nursing training advanced courses and basic training. So this is the funds that has been allocated under this program. And currently, when this complete, the question was, how are this training going to assist? So upon completion, especially with the medical students, as we are all aware that we are still not having adequate doctors in the country. So this is how they assist. But specifically under EMS training, one of the challenges that we have with our ambulances is at times we do have an ambulance and there is a critical person who needs to be taken because of the lack of the advanced ambulance professionals. Even though the ambulance is there and the basic people are there, we are not able to attend to that because you need why each and every year we are sending of them to complete the tertiary course so that we can have advanced people in order to make sure that our people receive quality services under these services. And for the nursing, we also, especially under tertiary and regional hospitals, we need the specialist nurses in order to look after the critically ill patients wherein they are referred from our district hospital or from the clinics. Thank you.
Thanks, Dr. Ndwamato. I think there was also the issue of the clinic that the chair you spoke about and other honorable members. We just received, because I know there have been challenges in one of those clinics. Maybe just to give a background, because there's the common trend. If you remember, there was a year where we were experiencing serious attack on our facilities. Letaba Hospital was one of the facilities that was, the doctors were shot. 2 of them had to even survive. They fought for their lives in ICU, and we thank God because we did not lose their lives. And there was again the following day, Liwahom under attack, which prompted that the Minister of Police during that year had to come to the province together with the former Minister of Health. And in our meeting with them, then the Minister of Police had brought in the team to do, amongst others, the assessment of the type of guards that we're having. Because what is happening is that as a department, we employ guards, which we contract a service provider who then employ the guards. But those guards, we noted from that exercise which was done by the South African Police Services generals that they were not even qualified. Some of them were not even allowed to can carry the guns and the weapons. And hence, but at the department, when we pay the service provider, we are paying them the tariff that includes those expertise. Now, they brought all those and raised the issue that one of the reasons why our facilities are in serious attack, like what we saw in Letaba Hospital, it's as a result of we are not having people who are well equipped and skilled to do that. So when the companies, new companies were appointed, one of the requirements, if in terms of the service level agreement, CFO, if you correct me, was to say you have to appoint qualified security guards who would have been trained and would be meeting the requirements. Then it's unfortunate that during the new transition, when the new service providers were appointed on the 1st of January, they were looking at, because we also at the same time says priority must be given to the current security guards. We don't want anyone to lose their job. We also equally want local to be prioritized on a job, because job like a security guard, you prefer local person, because hiring somebody from Movembe to go and work in Skukune, that person must also look for transport money. Every Friday when you want them to work night, they must knock off early so that they can go back to Wembe. So we have always been against that as the department. Now, what we have realized, these security guards who couldn't get appointed or absorbed by the new companies, they did not, unfortunately, meet that particular requirement. And I think that is one area where they are fighting. Only 2 security guards met the requirement. And in this particular clinic, there were, and there was a big fight with the others who were not employed. But currently, as I speak, the team from the district, they are busy having, together with the ward councillor and also the headman, with this, because it's Charlie Site Security Company, the information that I was given. They are currently in a meeting with our team to try to resolve this matter. They indicated to me that they will give me a report before closure of business today on what they have been able to resolve on. But this is a common trend that sometimes companies are blamed to say you are not appointing the locals. But when they ask for qualifications from the locals are not able to produce. But it is our view as a department that whenever a company is appointed, you have to prioritize the local. But we can't compromise qualifications over the locality. Otherwise, our facilities have been ambushed to an extent that we had to request South African Police Services and the South African Intelligence to come on board and try to assist. But otherwise, almost all the issues have been responded to. Let me just add on the issue of maintenance. I think one of the areas that, as Dr. Domba has indicated, that we have looking, it's not only your report, honorable members, that indicate the challenges we're facing on infrastructure. Even when I do my support visit, and also even when the executive management does their own visit, we have noted some of those areas, and some people will say, I'm waiting for 3 quotations to fix the window, and that we have seen it causing a lot of unnecessary delay. So one, as part of the proposal that we have given them, to say learning from, for instance, if you look at the Rural Health Matters project that we continuously embark on to try to reduce the backlog on surgical cases. We will go and hlasela a district and bring all our specialists that we have into that particular district so that we can be able to operate those. And we've seen it working. Not so long we'll be having another orthopedics, Dr. Ndwamot. Yes, Professor Steve Machize has agreed once more to come and assist. We've seen a lot of accidents over East. We need to get into making sure that our people are operated. We've got a lot of waiting list now on orthopedics, because orthopedics, unfortunately, as long as cars are moving, we should expect that we'll have a lot of fractures that we need to attend to. So what we saw, for instance, here in Capricorn District, we were worried to say, you go to Nobel Hospital, the toilet has not been fixed for so many weeks. Whereas when you go to another hospital in the same district, they've got 7 plumbers. Now that is where we have even done that audit to check where are we having electricians, and we're going to now have our Lichima and the pool, as Dr. Dombo is indicating, that they are going to do rounds like clinicians do rounds when they see patients and treat patients. So even the maintenance guy now, they're going to have the hub. They're going to work as a district, not in silo, so that if Matlala Hospital does not have a plumber, but Philadelphia has got a plumber, the plumber in Matlala, in Philadelphia, must also do the rounds and assist a Matlala Hospital. Because look, the issue that we are going to be issuing tenders and getting people to fix, there is no money actually to do that. The infrastructure money must be dedicated towards capital projects, which that's where we are going to do. And I was also informed that the hardwares have already been accredited, wherein hospitals will go and get the globe and come and fix it, and doesn't have to wait for the MEC on the honorable members when they do a support visit, or the HOD when she will be doing a support visit to do such. So that's what it's our plan in terms of dealing with all the infrastructure challenges. But of course, I must indicate, Chairperson, areas where in this program will not assist. If you go to Siloam Hospital, it doesn't matter how much hub you can have. If you go to Chidizini, if you go to Litaba, if you go to Khapane Hospital, that's where you need an overhaul of the infrastructure completely. You will need much more than the hub. And then lastly, on the issue of vaccination, all my, as I conclude, my appeal would be to honorable members to assist us in terms of the vaccination registration, where we are currently on a campaign. I think tomorrow, Premier has launched where he has registered and also assist on that particular day. I think we had around 30, 40 elderly people, which shows that our people are waiting patiently for this particular vaccine. We did not invite anyone. People just came hearing that the Premier is registering. They just came and wanted to be registered. People just had, I'm passing Giyani, and 40 elderly people came and wanted to be registered. Yesterday, people thought I would come to Mukopane. We had so many elderly people in Mukopane waiting for me. I couldn't make it because of EXCO and the other commitments. But you can see that people, they don't, our province is rural. Our people don't have internet access. They don't have data. They don't even have the gadgets. So what we are appealing is that for those of us who have got these gadgets, who have got internet access, let's assist them. We have seen what Western Cape currently is doing. The Cape Town has now rolled out Wi-Fi to any person who want to register. We don't have that in our municipality. You will not have that in your Musina municipality. So what we have is ourselves. So we are a rural, we are not a metro. We should be able to assist those people. Tomorrow we will be and our community healthcare workers in Sekhukhune, they have been provided with the cell phones now, so that we will be doing door-to-door with them, where we'll be helping and getting into the household to help our senior citizens to register. So honorable members, if they can assist us in making sure that we reach up, because if we don't vaccinate, we've seen what the virus is doing to India. We have seen, and we do not want to see ourselves and our people. At least let a person, even if they die, they must be able to die having had an access to a ventilator and access to a doctor. What I saw videos that have been sent in India where people are dying on the street without oxygen, without anything. People are just lying on the floor. We are a government that is caring, and the government that is led by a caring president and a loving president to his people. So we can't let down our president. It's only through us that the president will be able to achieve his dreams of getting the battle against COVID-19. As you rely on your support and on your guidance. And as you do those unannounced visits, as you do those support visits, some you do announce, we continuously appreciate the feedback that you continue to give to us. And we will always work together for the sake of the health of the people of Limpopo. Thank you very much, Chair. And thank you to my team here, to all of you for those contributions that you have made. And to the team, let's continue to do the work. Our enemy is the disease at the Department of Health. We have got no one to fight, but fighting all illness so that we can eradicate them outside our community. Thank you very much.
Thank you very much, Honorable MEC. My sincere apology. I was just on one call. It might have disturbed a bit. My apology. We just want to appreciate, Honorable MEC, the rural health matter. I'm quite impressed because most of my villagers where I'm coming from, honorable members, most of them, they've told me that they've been waiting on a queue for a long time just for an operation. And I think those teams of volunteers and the learned professor and yourself, MEC, that they go around in our hospitals and do operations, even hospitals that we didn't think that some of the operations could be done. We are seeing some. It shows that we have got that capacity as a province. We can continue to make sure that we improve the life and the health of our people. And we really appreciate the good work. From us, as a portfolio committee, I want to take this opportunity and thank the Honorable MEC. I think we'll be meeting on Tuesday to deal with other programs, including the outstanding reports that we have as a portfolio committee. And we believe that together we can do more. Together we can make sure that we take Limpopo to new heights. At all costs, we'll make sure that we are doing it for the betterment of our people. We are doing it for the betterment of our society. And this is basically what is expected out of us. And all of us, let's put hands together and make sure that we're all able to provide that needed support to the department, that needed support to the portfolio committee when it does its work. And together, doing this, I believe that we'll be able to reach to new heights and make sure that anything that the president has said, that Tumamina, Batupele principle, and also Tumamina to those particular poorest of the poor in the rural, deep rural areas of our province, where our mobile clinics galvanized through gravel roads, bad weather, and make sure that they want to provide services to our people, where our staff sleep 300 to 500 kilometers away from their loved ones to provide services to our people in those deep, deep rural areas of our province. We want to appreciate the good work that men and women in white and men and women in blue are doing continuously to make sure that they give service to our people. And with those few words, Honorable MEC, want to appreciate your time, and we believe that it was not a 3 hour of waste. It has been a 3 hour of effective work. And to your team, they're led by the HOD. We really appreciate that. Really, you team that can do the best, and that team that continuously being delegated to do its responsibility. Without much ado, as a portfolio committee, we'll declare the meeting officially closed. Before that, let's get announcement. Is there an announcement? Lerato?
Thank you, Chairperson. There are no announcements except for the one that you have already done regarding next week's meeting. Thanks.
Thank you very much. Honorable Maharaj joined us during the meeting. We want to appreciate that you were juggling between two meetings. Honorable Maharaj, Honorable Manaka, Honorable Libya, you were juggling yourself between two meetings, and we really appreciate that you did your best to make sure that you don't compromise any content of any meeting. You were able to move in between them. And MEC, be rest assured that as a portfolio committee, will always at given times do our oversight in the best interest of building the department, in the best interest of giving support to the department. And it's what we'll continuously do. And let's continue opening the interactions in terms of our engagement. Myself, I've got an open line to the MEC. I access it at any given time, and colleagues should be rest assured that there is no bad blood. I can call the MEC at any time, and she can call me back at any time, so that we are able to deal with issues that really speak to the department. And want to appreciate your resilience, MEC, and members of the portfolio committee. Want to appreciate that you are all here. We'll wait by Monday. Lerato, can you kindly make sure that you also schedule a meeting for either Monday or Tuesday, a meeting before we meet the department, so that I give the members of the portfolio committee a report in relation to our discussion with the MEC. Thanks very much. The meeting is officially adjourned, and let's go and do work. Let's push Limpopo forward, and let's make Limpopo to shine to new, better heights. Da.
Thank you, Chair.
Chair.